Hi everyone, it's your friend Doris the Coder back with another video. If you are new to my channel, welcome. If you're coming back, welcome back. This video is going to be a coding shout out So for you newbies, shout outs are when I find resources, often on YouTube, but not exclusively on YouTube, that you can use in your professional development for little to no cost. So YouTube is YouTube University and much of it is free. So this is going to be one of those free 99 ones. All right, so I'm shouting out today regional anesthesiology and pain medicine. This is going to be helpful for those anesthesiology coders as well as acute pain coders. There may also be some utilities on the pain management side with chronic pain because they cover a great deal of nerve blocks. Now, again, the title of the page is regional anesthesiology and acute pain medicine. So that's commonly going to be what you see, but blocks have utility in different settings, right? So it could be acute or chronic pain. The technique will be no different despite the utility. So you can find them on YouTube. You'll find this channel very helpful. We're seeing a lot of blocks now. I'm going to do 2 videos after this. One to talk about what planar blocks are versus non-planar blocks. And the next one we'll talk about the coding for all of these different blocks that we're seeing. But in order to do that, the primer really is to understand what these blocks are. And this channel will be immensely helpful to help you. Dr. Jeffrey Gadsden, a special thanks to him, as well as Dr. Kavan Clifford, had the opportunity to attend a sono anatomy workshop where they demonstrated what these blocks would look like, as well as the imaging and locating of the structures using sonography, which is something that's going to impact that's already impacting our industry. We have to remember that medicine advances faster than the codes advance. So there's going to be a gray area. So if you want coding guidance on how to report a lot of the blocks that you're going to see on this page here, you want to look for my next 2 videos specific for pain. So they cover things like ESP and IPAC and pings and spank blocks and SIFI blocks, which are suprainguinal fascial-iliaca blocks. And I'm going to talk about in my other video the difference between the acronym when it's a planar block versus when it's just an acronym that's not really a planar block. So where you would be using a established code versus an unlisted code versus a named established code. So 64450 versus 64999 versus another established code. So a primer for this is going to be this channel, because a lot of times we look for the documentation to match what we see in the book, and that's not the case. So I'm going to talk a little more in detail about the next one. Another special thanks to Kelly Dennis. Her channel, she is also on YouTube, Kelly's Anesthesia Tips. Go ahead, check out, subscribe to that one. She actually did one on IPAC block. I learned of this sono anatomy workshop through my membership, which I learned about this organization, the FAAA, from Kelly Dennis's channel. So this is the importance of networking and educating yourself. I never knew of the FAAA, and had it not been for the membership through the FAAA, I would not have known about the FSA's partnership with them and had the opportunity to attend the workshop that recently took place last weekend in West Palm Beach. So if you are in Florida, side note, if you are in Florida and you're in the field of anesthesiology on the business side, the FAAA is absolutely an organization that you want to take part in. We go back to this channel, Regional Anesthesiology and Acute Pain Medicine, you're going to learn what the blocks are on a lot of these videos, how they perform them, the contraindications for them, why they perform them. They don't talk about the coding, but then you'll get an image of the sono anatomy, the anatomy structures that you might look out for, so you better understand where these blocks land as the coding kind of catches up with what's happening in medicine. So I am your friend, Doris the Coder. I'm going to sign out with another video with this video. But again, if you're interested in the coding detail, this is a shout out. Shout outs are really just me sharing resources with you. So they're very quick videos. It's not this, but this is going to be a primer for you. I will, in my next video that I cover on pain, talk more about what we're seeing in the industry, some of the conundrums that currently exist with these blocks. Planar blocks versus these acronyms that aren't quite planar blocks and how we code them. But until that video, I'm going to sign out and I'll see you in the next one. If you want to know when I post as often as I can. But if you want to be notified of when I post, go ahead and go to my channel. Subscribe like I did here. You can click on the bell and make sure you hit subscribe, click the bell and do all. So anytime I post, you'll know, you'll be notified. And if I go live, which I'm still technically trying to learn how to do, I'm not great at technology, which is why one side of my picture I notice is like dark. I'll figure that out one day. I'm not great with technology, but no, once you subscribe, you'll know when I go live and all of that good stuff. So I'm Doris the Coder signing out. And until the next video, I will see you then.